Hello, my name is Carly Hyatt, and this is my head-to-toe assessment video for Nursing 111. I have gathered all of my supplies. My stethoscope is cleaned and sanitized. I have my pen light. I also did a room scan as I came in. I provided privacy all the way around, and I performed hand hygiene. So now I'm going to go ahead and introduce myself to the client. Hello, my name is Carly. I'm going to be your nursing student today. We are going to be doing a head-to-toe assessment on you. Can you go ahead and verify that name and birthday for me?
Laura at 9/17/81.
Okay, this is when I would go ahead and verify her name with her wristband as well as with any other medical records that we were going to be using. Pretty much what a head-to-toe assessment is a way that we can systematically analyze your whole body to make sure that everything's functioning correctly. Now I would be assessing her vitals, so I would assess her temperature to make sure that it was with 97 to 99. I'm going to assess her blood pressure to make sure that her systolic was 90 to 140 and that her diastolic was 60 to 80. I would also be checking her respirations to make sure that they were 12 to 20 breaths per minute and that her chest was rising and falling appropriately. And then I would be assessing her heart rate to make sure it was 60 to 100 beats per minute, that it was the rate and rhythm was good, and that it was symmetrical. I will be doing this for all pulse checks throughout the whole assessment. I'll also be assessing her skin to make sure that there are no lesions or anything like that. And I'll also assess her pain. Are you having any pain today?
No.
Okay, if she was having any pain, I would ask her to rate it on a 0 to 10 pain scale, and I would assess the character, the onset, the duration, if anything makes it better or worse, and then if it radiates anywhere in her body. I'm also going to be doing a skin assessment, so like I said, assessing for any lesions, open wounds, color, temperature, moisture, if she has any IVs, invasive lines, drains or dressings or anything like that that I should be aware of. I will be doing this throughout the whole assessment. I'll also be rating her on a Braden scale to rate her risk for pressure injuries. So if she had anything below 18, this would mean she would be at risk for a pressure sore. If she was between 23 and 19, then she is at little to no risk for a pressure sore. So I'll be doing this through the whole assessment. All right, we're going to start going in to assess her head. Like I said, I'm going to be looking for any lesions, color, temperature, or moisture that I should be aware of. And then I would also ask about any learning disabilities. So do you have any hearing aids?
No.
And then do you have any learning disabilities?
No, ma'am.
And then do you wear any corrective lenses?
I do not.
Okay, so now that that is all out of the way, I'm going to start by assessing her nose and the patency of her nares. So I'm going to include one nostril and she's going to breathe in. Okay, same thing. All right. And then I'm going to be checking her 9th and 10th cranial nerve. So if you can open your mouth for me. Her lips, her teeth, her tongue, and her oral mucosa looks good. And then you can say ah. All right. Her palate rises and falls symmetrically. And this is also when I would check her gag reflex as well. And then now I'm going to inspect her eyelashes and her eyelid to make sure that her eyelashes and everything are distributed evenly, which they are. Now I'm going to test her 3rd and 4th cranial nerve. So if you can follow this pen for me. Make sure to keep your head still. Okay, and then we're going to go in. Okay, and then this is when I would dim the lights. And I'm checking the pupils. Okay, so her pupils are round, reactive to light, and they accommodate, which is everything that we are looking for. And then we're going to be checking her 11th cranial nerve. So if you can push up on my hands against resistance with her shoulder, and then as well as your cheek. All right, and this is also when I would check her jugular vein distension. I would place her in bed at a 45-degree angle and assess her neck for that. So now we're going to be palpating and auscultating your carotid arteries. You're going to do these one at a time, and you're assessing rate and rhythm as well as if they're symmetrical. Okay, now we're going to auscultate with the bell of the stethoscope. Okay, we're listening for any abnormal sounds like swooshing or bruise, None of that was heard today. And then that is all for her head. So now we're going to be doing her upper body. So first thing I'm going to do is assess her hands. I'm looking for any color, temperature, moisture, or open wounds, as well as on her arms and her upper body. And then we're going to be checking cap refill on her fingers, which should be within the 3 seconds. We would do this for all 10 fingers, and that looks good. Now we're going to be assessing your pulses. We're going to do these at the same time to assess for symmetry. Okay, the rate and rhythm the rate should be within 60 to 100 beats per minute, and the rhythm is good, as well as they should be symmetrical. So now we're going to be doing some range of motion, so if you can roll your shoulders for me. Okay, and then if you can stick your arms out and bend your elbows up and down. Are you having any pain with that?
No.
Okay, and then roll your wrists for me. Okay, and then go up and down. Okay, now we're going to be checking your grasp, so if you can squeeze my fingers. Okay, that grasp is even. Now we're going to be assessing her sensation. If you'll close your eyes, let me know where you feel my hands.
Upper arm.
Okay.
Lower arm.
All right. So that is all for her upper body. Now moving on down to her chest, we're going to assess AP diameter. So her chest should be twice as wide as it is deep. Now we're also going to be assessing her rate and rhythm, which should be 12 to 20 breaths per minute. Her chest should be rising and falling equally. It shouldn't be too shallow or too deep for the situation. Now we're going to auscultate her lungs. We're going to do the 10 points in the front and the 10 in the back, as well as the 2 on the side, listening for any wheezing, rhonchi, stridor, or crackles. Okay. You'd be taking a deep breath for me at each of these. 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, now I'll do the 2 on the sides. Okay, now we're going to do your back. Okay, same here, 10 spots on the back. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay. Now we're going to palpate her mitral valve, or the point of maximum impulse, which is that left fifth intercostal space, which is going to be right here. You want to assess rate, which should be 60 to 100, as well as rhythm. Now we are going to auscultate your heart sounds using the same area of the scope. Okay, her right second intercostal space is going to be that aortic valve. That left second is going to be the pulmonic valve. That left third is going to be Erb's point. This is where S1 and S2 are heard equally. That left fourth is going to be the tricuspid valve, and then that left fifth is going to be the mitral valve. We'd be listening for S1 and S2, making sure that we didn't hear any S3 or 4, any abnormal heart sounds. Okay, now we're going to be moving on to her abdomen. So I would assess for contour to make sure that her stomach was flat and round, that there was no distension. Also going to be assessing the skin for any open wounds, lesions, temperature, color, anything like that. Now I'm going to ask about bowel movement. When was the last time that you were able to have a bowel movement?
This morning.
Okay, and then are you having any urinary continence or retention?
No.
Okay, now we're going to auscultate her bowel sounds. You want to do this before palpating so that you do not interrupt any of that movement. We do all 4 places of her abdomen, starting with right lower, right upper, left upper, and left lower. We will be listening for 1 full minute in each quadrant, listening for 5 to 30 sounds a minute. If you were hearing hypoactive bowel sounds, you would want to make sure that you listen for a full 5 minutes to ensure that it was hypoactive. And then now we're going to begin palpating the abdomen for any pain or distension. Let me know if you have anything that's uncomfortable. Anything hurt here?
No.
Okay. And then this is also when I would palpate her femoral artery as well. And we would be assessing that same rate and rhythm with that. Now moving on to her lower extremities, we're gonna begin with checking her toes for capillary refill. I would also be assessing skin color, temperature, moisture, anything like that through the legs. Okay, capillary refill on all 5 on each foot within that 3-second line. Now we're gonna assess for her pulses. So her posterior tibial pulse here, 60 to 100 a minute. We would assess that on both feet to make sure that that was symmetrical. Make sure the rate and rhythm is good as well. And then that tibial pulse here on the top of the foot. Okay, same for that with the rate, rhythm, and symmetry. Alrighty, now we're going to be doing some range of motion, so if you can stand up for me. I need to scoot it back a little. Yeah. Okay, so we'll first go out with the leg and come back with it. Okay, now we're gonna cross to the middle and go out to the side. Okay, and you wanna roll that ankle. Okay, same thing with this leg. So we're gonna go out, or that's fine. And then to the side and go back, and then across the middle. And then we're gonna roll the ankle. Okay, and then pull the knee up as you can. Okay, same thing on the other side. Okay, you can go ahead and sit back down for me. Now, if you can scoot to the front of the chair with your feet flat on the floor, and then push up on my hands. Okay, nice and strong. And then now last thing we're gonna assess is your sensations. If you'll close your eyes for me, let me know where you feel my hands.
Upper leg, lower leg, inside lower leg.
Okay, and does all that feel even for you?
Yes, ma'am.
Okay, and that is finished head to toe assessment.